Hi, today we're talking about promoting positive parenting. Um, Parents don't get a handbook when they get babies to take home, and it can be really challenging. So, one of the things that we are hoping to accomplish with this is to help people to have some strategies ready to go based on the different ages and stages of their children. So, if you think about how you were parented, were you yelled at? Were you spanked? Did you get time out? Were privileges withheld? Was affection withheld? And as you think about that, I want you to consider whether or not that changed your behavior. Did it have the intended effect? One of the things to remember about um, appropriate positive parenting is that discipline teaches, but punishment overpowers. And so part of the challenge of being a parent is to recognize that distinction between um, discipline and teaching and just punishing to win in a situation. So we're going to look first at infants ages birth to 18 months. Babies need caregivers who respond quickly to their needs. They need caregivers who will look back and forth at them, laugh and play with them, talk to them. This is known as serve and return. You and your baby establish a back and forth exchange similar to a tennis match. When they're upset, they also need caregivers who are going to do things like feed them, change their diapers or their clothing, cuddle them and hold them, make sure they aren't too cold or too warm, and establish routines. You need to recognize that responding quickly to their needs establishes safety and it establishes trust. So, what if your baby keeps crying? That's a something that sometimes happens. We call it colic. We call it, um, you know, uh, just cranky baby, burpy baby, whatever you want to do. But recognize that when babies cry, that's the way that they're talking to you. That's the way that they're sharing with you what they need. Babies cry to communicate. And as their brains grow, they're learning what words mean, what your facial expressions mean. They start to learn your tone of voice, your nonverbal cues, and they need you to figure out what they need and fix it. So think of it as not that they're trying to really bug you and get on your last nerve, but they're trying to tell you something, and you want to figure out what that something is. So what can we do when babies cry? First of all, recognize and accept that all babies cry. There's nothing unusual about what's happening here. So some of the things that you can try to do is keep to a routine, respond quickly to their needs, pick them up, rock them, soothe them, check for the what I call the DFTBS, the diaper, the food, temperature, whether it's illness or room temperature, burps, and sleep. Do they need it? They can sometimes be very cranky when they're tired. Some of the other things you can try is to use a pacifier to swaddle them so that they feel safe and secure. Take a walk, play soothing music, sing to the baby, talk to the baby, give them a bath. If you're on your last nerve and you really need a break, hand over the baby to a trusted adult who can care for them while you de-escalate, and step away if you're overwhelmed. And then when you're, back to your usual happy self, then you can resume in that parenting role. Sometimes all it takes is 20 minutes of being able to have a little breather so that you can both reset and start again. Don't do this. If your baby continues to cry, don't ever shake them. It can cause fatal injuries. What's called a contre-coup injury. When you shake a baby, their brains are smaller than the head cavity, and it shakes around in there and can whack on one side and bruise internally. Don't do that. It can cause, in addition to death, blindness, brain damage. We don't ever want to do that. Never hit the baby. The baby's not trying to upset you or trying to be difficult. They're trying to communicate. We wouldn't hit people who are trying to talk to us because we don't understand what they're saying. We don't want to ignore them, scream at them, punish them, or leave them unattended. Um, Babies are hardwired to connect with caregivers, and any of these strategies will really inhibit their ability to not only connect with you, but to connect with others throughout the lifespan. I just want to talk a little bit more about shaken baby syndrome. This happens sometimes when people shake babies and cause this traumatic brain injury that we just talked about. Babies have big heads, but they have weak necks, and a floppy head can seriously injure or destroy brain tissue and blood vessels and cause those internal brain bleeds. And the increased pressure from that blood pooling within the skull can cause further brain damage. I have personally seen shaken babies, and the lifelong injuries that come from it. It's a real thing. Please be careful and never, ever, ever shake a baby. So, positive discipline strategies for infants, it kind of sounds a little contraindicated that there would be discipline for infants, but some of the things that we can do for them are really crucial for their positive development. When we do these things, it creates trust, safety, it helps with bonding between the baby and caregivers. It helps babies be more content and compliant actually throughout preschool. It has that, laying that foundation can have that impact moving forward. And it's a primary predictor of a child having pro-social skills and a positive behavior throughout the lifespan. Recognize that babies are designed for connection. That's their whole primary goal. And so when we are taking care of them, when we are talking to them, when we are making sure their needs are met, they're learning that the world is a safe place. It's really important to understand that there's a crucial need for infants to have that serve and return and engagement with their caregivers.